I'm Savita Malla, who's the lead as well as the Advocacy and Communications Advisor based at the National Planning Commission with the National Nutrition and Food Security Secretariat. When we met last in 2015, the multi-sector nutrition plan was at its implementation stage. This is 2017, this is the last year of the multi-sector nutrition plan. In our last meeting, I gave you a brief update about how the multi-sector nutrition plan came into being. There was a nutrition gap analysis done in 2009, which laid emphasis on a multi-sector approach to tackle the issue of malnutrition, especially in women and children. The vision of the multi-sector nutrition plan is over the next 10 years is to take the country on a pathway which reduces malnutrition, chronic malnutrition in women and children, so that it no longer becomes an impeding factor to enhance human capital as well as in overall socio-economic development. The main purpose is to strengthen the capacity of the National Planning Commission and key ministries on the multi-sector nutrition program policy planning, implementation and monitoring for improved maternal and child nutrition at all levels of society. The MSNP will contribute towards attaining the goal by achieving the three major outcomes. Outcome 1, policies, plans and multi-sector coordination improved at national and local levels. Outcome 2, practices that promote optimal use of nutrition-specific and nutrition-sensitive services improved, leading to an enhanced maternal and child nutritional status. Outcome 3, strengthen capacity of central and local government on nutrition to provide basic services in an inclusive and equitable manner. For the MSNP2, actually no, the overall goal won't change. There will, however, be more emphasis on ensuring more alignment with the SDGs and WHA targets, and more emphasis on increasing rate of reduction of stunting. In the deprivation analysis workshop, deprivation analysis for malnutrition workshop, highlighted challenges with inequities and thus focus will be placed on reducing the inequities seen by geographic locations, education of mothers, ethnicity and gender empowerment. A more robust monitoring framework will be developed to track progress, implementation coverage and trends, as well as identification of bottlenecks around the three areas of, let's say, supply, demand and of course the enabling environment. Financial tracking to ensure increase in budget allocations will also be looked upon well in the MSNP2. For the implementation of the MSNP2, actually in Nepal, we have a nutrition architecture in place. At the central and national level, we have the high-level Nutrition and Food Security Steering Committee, which comprises of secretaries from the various ministries, which is chaired by the Vice Chairman of National Planning Commission. We also have the National Nutrition and Food Security Coordination Committee, which has members up to the Joint Secretary level from all the concerned ministries. And this committee is chaired by the Honorable Member of National Planning Commission who looks after the social sector. We also have several technical working groups such as the Advocacy and Communication Technical Group. We have the MNE-MIS working group, and we also have Capacity Development Working Group. There are also various platforms. We have the Academia platform, we have the Civil Society Alliance for Nutrition. So these are the forums that we have at the national and central level. At the regional level, we have the Regional Level Nutrition and Food Security Coordination Committee. At the district level, we have High-Level Nutrition and Food Security Steering Committee, which is under the local government, which is responsible for coordinating with all the sectors. And at the local level, at the VDC level, we have the municipal level Nutrition and Food Security Steering Committee. So we have these committees and these forums in place that help in the implementation and in taking the work forward. The last time we met in 2015, the Government of Nepal was implementing the plan in 12 out of the 28 priority districts. This year, we have reached all the 28 districts that were prioritized in the MSNP. Well, there will be more districts added in the second phase. Thus, the plan was followed using funding from government and partners like UNICEF through the EU funding and Suhara through USAID funding. So, partners and donor agencies have been involved in the implementation of the MSNP. Yes, all the districts were facilitated with the same guidelines which were developed by the National Planning Commission and followed the local level participatory planning process. So yes, there was a uniform approach. The earthquake which struck Nepal in 2015 was unforeseen. And indeed, yes, focus did turn towards the 14 earthquake most affected districts. However, the MSNP guidelines and protocols really helped to quickly build capacity and response in the earthquake affected districts. But currently now, the focus is back to the 28 MSNP districts after the earthquake. The Government of Nepal has played a very important role and has shown commitment towards dealing with the issue of malnutrition in women and children. The government has committed $3 million for MSNP. NPC continues to lead the coordination of the multi-sector nutrition plan, and of course sector ministries are implementing the MSNP activities at the district level. The Government of Nepal is also working on a south-to-south collaboration. For instance, recently we had a team from Tajikistan who were on a study tour to Nepal to learn about our multi-sector approach and multi-sector mechanism. There was an article about this south-to-south collaboration done by the ENN, which is also available on the Emergency Nutrition Network website. Development partners play a very crucial role in the implementation of the MSNP, as they are providing technical assistance. For instance, they are supporting the National Nutrition and Food Security Secretariat, which will help strengthen coordination role of the National Planning Commission, and various other technical assistance are also provided by them, who are placed at the Ministry of Health and the Ministry of Federal Affairs and Local Development of the government. Development partners have contributed about $100 million for the implementation of the MSNP for the next 4 years. And they are also supporting the strategic planning roadmap for the formulation of the MSNP too. So the development partners are key, very crucial to the implementation of the MSNP. Civil society network in Nepal has been actively involved in the multi-sector nutrition plan, and it is well organized at central as well as at the district level, and is also engaged in the awareness raising and is also providing inputs at the planning process at the central level. So they are actively involved with us. Based on the monitoring and evaluation plan of the multi-sector nutrition plan, the common result is being tracked. The framework consists of mainly 3 elements. One is to strengthen government information systems like the HMIS by making sure that the appropriate indicators are collected. 2 is development of a surveillance system, which is currently being piloted in 2 districts of Nepal, which are Kapilvastu and Acham. And 3 is a robust evaluation. Currently, an evaluation organization has been contracted by UNICEF to carry out a robust evaluation of MSNP in the 28 MSNP districts of Nepal. This is learning by doing. While implementing the MSNP, we realized there were a lot of gaps and challenges. So for MSNP2, we are looking at a more robust monitoring framework with key indicators by sectors collected on a regular basis, which is very critical to track progress. We are also looking at alignment of nutrition-specific and sensitive interventions with the Lancet series on maternal and child nutrition of 2013, and more emphasis on gender empowerment and social inclusion to narrow the inequity gaps. There should be more focus, or let's say new focus, on reduction of maternal and adolescents malnutrition as well. These were some of the gaps and challenges identified while implementing the MSNP, which will be addressed in the MSNP2.